We're trained to be able to assess and understand the body from a medical perspective, but then we work toward bringing the body back into balance using natural means.
Hi, Kim and Jamal here from Life Strength and Health, where it's our mission to help you to improve and optimize your health naturally. So if this is of interest to you, make sure you click that subscribe button so you do not miss future episodes. Last month, I released a video about my personal journey of starting in corporate America, losing my health, finding holistic health, experiencing the benefits of that, and then moving into entrepreneurship. So if you want to check that out, I'll list it in the info card section above. So now it's Jamal's turn to share his story. I'm going to be interviewing Jamal in this video because it's important for you guys to know who we are, not just because of our expertise, but also our personal stories as well. So Jamal, welcome to the video.
Greetings, everyone. Peace and blessings. Pleasure to have the opportunity to share a little about myself with you.
So let's start with the first question. The first question I have is, why did you decide to go into the natural health field?
The way I look at it, that question is in two parts, natural and health. From a health perspective, I've always had an extreme interest in health. Growing up, my mother was really into health. I remember at a really early age, she was taking us to a juice bar to get fresh juice. And I always found that to be fascinating. I remember when she bought her first juicer and she was always trying to mix up different herbs and home remedies and things like that was passed down from her mother and my great-grandmother. So in the family, we've always been into natural health in a sense. So I always tended to gravitate toward that. So when I did my undergrad, I studied exercise physiology, which covered nutrition as well. But as I began to look at health, one of the things that I noticed was even when you follow the path of popular health and what we've been taught about nutrition and exercise, people still were getting sick. And it always was a question for me, like, why is it that when you do the things that you're taught to do and that you're told to do, when you follow the so-called food pyramid, when you exercise in the way that you're supposed to, why is it that we're still getting sick? One of the other things that I began to look at, my mission is to help everyone, right? Help everyone to optimize their health. But I started to look at the health of Black people overall in the United States, especially Black men, but just Black people in general. And we lead in so many areas of health challenges, from cancer to heart disease, and many other things. We're leading in those things. So I took a special interest in trying to understand why. And I began to understand that it's a lack of education. A lot of times it's a lack of means. In certain communities, there wasn't access to certain foods and things like that. So I took a special interest in helping Black people understand health from a different perspective, understand how to take care of themselves differently. But also, I started to look at the missing pieces of the puzzle in health in general and what was missing that even when we tried to go on the path to health, we were still getting sick. So that took me on a journey of not only natural health, but holistic health. Understanding the whole picture, understanding that health is so much more than simply what you put into your mouth and the capacity at which you move. It's so much more than that. And that began my journey of understanding.
So as you embarked on your journey to getting a better understanding, this is going to require some training, right? So, and this is a common question that we receive sometimes from new clients that are interested in working with us, they'll ask, okay, what is Jamal's trainings?
Well, I'm trained in clinical nutrition, right? That's like the standard nutrition that people have. Clinical nutrition. I've also been trained in holistic nutrition as well. I've been trained in exercise physiology, which is more of a holistic approach to looking at movement as opposed to just personal training. I've been trained in herbology, as well as something called GAPS, gut and psychology syndrome, which specializes very specifically in gut health, as well as detoxification. I also have naturopathic training. I am a naturopath, and there's two different types of naturopath. You have a naturopathic physician, and then you have more of a doctoral, a higher education naturopath. That's me. I'm not a physician. I don't practice medicine, but what naturopaths do, the non-physician ones, we're trained to be able to assess and understand the body from a medical perspective, but then we work toward bringing the body back into balance using natural means. Those means could be nutrition, it could be emotional components and just the way that you live overall. It could be through supplementation, which includes herbs and many other things, many other practices that fall under holistic health. So we are able to properly assess the body. We can take your medical work and assess and understand that, and then move accordingly to bring your body back into balance. We don't treat diseases and sicknesses. What we do is we understand the unique imbalances that a person is experiencing that may cause these medical challenges, and then we work toward bringing the body back into balance. And what we usually find is that when the body is balanced, it doesn't experience those diagnosable medical challenges. In addition to that, I've been trained in various techniques to help address things that we don't really consider a part of health. Looking at emotions, such as EFT, helping your body to release motions naturally, and how to address stress overall. So I use all of these techniques to help people depending on what it is that you need.
So over your years of working with so many clients, we've been in business over 14 years, when we first started out till now, your approach has just been refined and improved over the years based on the different clients that we've had. So now, what is your approach to helping clients?
My approach is, I would say, an approach of openness. A lot of times we have one way of doing things. What I notice over time is that one approach helps some people, but then it wouldn't help others. And I realized that you can't superimpose your approach over everyone's complications. So there has become an openness of understanding that everyone is on their own unique journey that requires very specific things that are unique to them. So over time, I fine-tuned it so that everyone that I work with is on their own individual plan. I can have a couple of people that come to me for the same exact reason, but their plans are going to be a little bit different, because that's a very important piece of the puzzle. And the more you can drill down and get specific with someone, the more profound your results are going to be.
So it's easy to get overwhelmed with the amount of information that's out there. It's important when you're working with a practitioner to really understand what they specialize in or what's their approach so that they can help you more. So what do you feel separates you from other natural health practitioners?
When I think about that question, I think about our journey. I'm talking about Kim and myself. And when we got into the business, we really looked at the components that people needed to get real results, for it to actually work for them. There are so many people that go to practitioners. I'm not calling anyone out or anything like that, but they go to practitioners and they don't get the results that they were looking for. And it's not that the practitioner wasn't educated enough to be able to help them. It was the system that was designed to actually be able to help them. And over the years, we have been fine-tuning our system so that it really works, so that it really helps you. And what we realize is that not many people are good left with their own devices. So a lot of times you will go to a practitioner, you will, get assessed, you'll get your program, and then you leave, and then you may come back months at a time. And then during that time, you're expected to achieve and accomplish certain things. We take a very systematic approach in helping you. We hold your hand along the way, and we make sure that you are being educated and supported so that you could achieve the results that you're looking for. We have milestones that we're looking at. We have frequent consultations and other means to keep you connected to us. And we find that the people that we work closer with have really good results. In addition to that, we take a true holistic approach. A lot of times, all of these different modalities that fall under the umbrella of holistic health, someone could do one of those things and call themselves a holistic practitioner. We practice real holistic health. So when you come to us and you work with us, it's not just nutrition, right? We can't just work on nutrition. We have to understand your stress levels, for example. And if you're stressed out or your stress levels are high, that needs to be addressed. And we take a systematic approach in addressing that. It doesn't matter what area it is. We're looking at the whole, and we are addressing your imbalances, and we are there to support you along the way. And what we find is that the people that are able to follow through that process, they see real results, and it actually works for them.
There's many levels to holistic living, and on social media, or you may talk to someone and you hear about these amazing results, but a lot of times people really don't understand the process that is required, or the consistency, or there is an order of events that should occur if you want to truly live a holistic lifestyle. So what would your advice be for someone who's interested in taking a natural approach to improving their health?
To be honest with you, we're in the information age right now. We can get any type of information that we want at the click of a button, and that's good and it's bad. I think it's good because it's important for you to educate yourself and to understand. With all information, there comes context. Like, you have to have the proper context. And I see a lot of people sharing information with others and recommending things for others that is not in its proper context. I see a lot of memes and things like that that are embellished and not in their proper context. So I think that it's important to actually seek out professional help. Just because your friend or family member may have had success doing something, yeah, you can get a little bit of information from them, but it doesn't make them an expert, right? When it comes to nutrition, because it's readily available, and we can go to the store and get food and eat, and we may have certain results, people automatically think that they're experts. And I think it's important to get professional help to get you along the way, and then let your education and the things that you're reading kind of support that. But if you really want to do it the right way, you got to just go ahead and get the professional help. When we have people that come in that, take that alternative path, A lot of times they're doing the wrong things, and that's why they come in, because they're taking this approach that they thought was right and it's not working for them. So instead of trying to figure it out on your own, just go ahead and get help. There's all different levels of help, but I would recommend getting some help to help get you on the right track.
As I mentioned earlier, the natural health, holistic health industry is becoming more mainstream, and more people are learning more about it. And there's definitely more of an interest to get into it as a profession, but it's not so cut and dried. We do get people who call our center who would like to intern or who are interested in going into the field, but they don't really know where to start. So what's your advice for someone who's interested in becoming a natural health practitioner?
I think the important thing overall is your mindset. I think that's the most important thing, is the type of mindset that you have. A lot of times we gravitate towards certain things and it becomes us. Like, there are a lot of different approaches. There's a lot of different diets. There are a lot of different types of health regimens. A lot of people get locked into one way of doing things. And I believe that that's a mistake, because everyone is different. I think that it's important to be open and go on a journey of understanding as much as you can to put all of these pieces of the puzzle together, because there's always different sides of the coin, and we are trying to find that balance. You have people that are for vaccinations. You have people that are anti-vaxxers. I think instead of choosing a team, you learn both sides of things so that you can recommend accordingly, or so that you can have a balanced perspective, as opposed to just imposing what you think. We have extremes such as like a keto versus veganism. Just because you may be a vegan, it doesn't mean that the whole world needs to be vegan, or all of your clients need to automatically become vegan. It doesn't mean that. So you have to be able to separate your personal beliefs and what it is that you want to do, and be able to meet your client where they are, and be able to do things that's going to optimize their health. If you believe in keto and you get someone that needs to be a vegan, you have to be able to recommend and be balanced in a way that you're not biased. So I just think that we get so caught up in these camps, someone's following Dr. Sebi and the alkaline diet, and everyone needs to be alkaline. It's just so many different areas of health, and I think it's important to be open to all of them, because you can achieve health from many different paths. So if you're open in learning, you can specialize in things, but you need to have more of an open mindset when it comes to looking at all of these things, so the biasness doesn't come through and it limits your path of being able to help people. Because I know, like, as I continue to expand and open up how I see the world, how I see health, it actually makes me better at being able to help people. And I still continue to expand. I still find myself doing things and recommending things that I never would have 10 years ago, but now I see that these things are actually beneficial and effective.
So that is the conclusion of our interview with Jamal. If you like the video, make sure you click that like button. And if you're interested in taking a natural approach to improving your health, we created a playlist with some of our videos that will be beneficial for you to watch. I'm going to put that right below this video. So thank you for watching. Stay tuned for the next video. And until next time, live healthier.
Live healthy, everyone. Peace and blessings.